Welcome back to the channel. It's Dr. Durst. If you are new to the channel, I am a traditionally trained physician that now specializes in regenerative medicine with a focus on sexual medicine. Today, I want to discuss why we ever stopped using hormones in women. This goes back to a large study that was done by the National Institute of Health, NIH, and it was termed the WHI, or Women Health Initiative Study. It was started in 1995 and supposed to go 8.5 years, but halted early due to some increased risk of cancer and cardiovascular disease. And since 2002, we basically have scared patients and physicians away from hormones in women. But why 20 years plus are we still doing that? Was it a valid scare? And what should we be doing now about it? So the WHI had 27,000 women where they were studying hormones. It was about 116,000 patients, but they were looking at low-fat diet. With one study, they were looking at vitamin D and calcium supplements. With another study, they were doing an HRT study, and then they were doing an overall survey observational study arm. 27,000 of them were in the HRT study, and there were two arms in that study. One was an estrogen only, and one was a progestin and an estrogen arm. The reason that they did a progestin and estrogen arm is because if you had a uterus, we know that estrogen divides or proliferates tissue. So with that division, progesterone or progestin, because it was a synthetic, is thought to oppose that proliferation of estrogen and oppose the estrogenic effects. So was that risk really reported accurately? Well, it was certain that the media got a hold of it and that there was this big headline, and it scared all patients and all physicians away from hormones in women. 25% increased risk of breast cancer. So we knew that they were controlling symptoms, and they were synthetic hormones. And the two hormones that they used was Premarin, which was a conjugated equine estrogen, and then that was a synthetic estrogen. And then they were using a progestin, medroxyprogesterone, or Provera. Both of those being synthetic and not identical to your body's hormones or a woman's hormones. And so in that, they noticed a 25% increased risk of breast cancer in the combined arm of the synthetic estrogen and progestin, when in fact, most of the complications or increased risk was noted in the arm with both an estrogen and a progesterone and synthetic. So I'm just shortening those terms, and not just with the estrogen alone. So even the estrogen alone, which was synthetic, wasn't causing the issues. But was that 25% increased risk that hit the media channels? It hit everything. And so the physicians are still afraid of that. But was it real? And was it accurate? So in fact, if you look at the data, there's 4 and 1,000 in the placebo arm, the arm that wasn't getting anything. And there was a 4 and 1,000 in the placebo arm of breast cancer incidence. There was 5 and 1,000 in the treated combined arm. So that meant, yes, relatively, that was a 25% increase, but it was just a 1 in 1,000 per year increased risk of breast cancer. There's lots of other issues with that study. The biggest one, in my opinion, being the synthetic, because we use bioidentical now. So to compare bioidentical synthetic isn't comparing apples to apples. And we don't have a lot of good studies yet that really compare just bioidentical. So progesterone is what we would use now as a bioidentical, and estradiol is the estrogen and not a conjugated equine estrogen, which, by the way, is horse urine estrogen with lots of different estrogens in it. And so we would want to do bioidentical. So that's my number one problem with this study, but also even studies from since then, in the fact that we use bioidentical today. So that's number one problem. 2, it was reported inaccurately. That's a relative risk and not an absolute. The second thing is that study was women between the ages of 50 and 75, with the average age being 63. So that is an older age to start hormones, and many of those patients weren't actually symptomatic. And so if it's life-changing, you have severe symptoms and you're taking hormones, That's quite a bit different than you're placed on hormones. You don't understand the value of it. And now they're telling you have a 25% increased risk. And patients could at any point opt out of that study. So synthetic and inaccurately reported risk, and the risk was in one arm with the synthetic, and then asymptomatic in an older patient population. So if we transition patients from premenopausal to perimenopause and 10 to 14 years before menopause, that is in between that 50 to 60. The average age for menopause is 51, that transition over. So if we're not treating until 63, and that's the average age, and they're asymptomatic, and they did have an increased risk of cardiovascular underlying disease, but also a little bit less than 50% plus were non-smokers, but about 43% had either currently smoked or had previously smoked. So slightly increase in the risk factor underlying, and now placing on synthetic hormones with some adverse outcomes. But those adverse outcomes have not panned out. If you had 1 in 1,000 increased risk of breast cancer in the year, but you had life-changing benefit with symptom control, that would be huge for somebody. But those were synthetic and not bioidentical, and that risk factor is significantly lower. That is well proven, but not addressed since that WHI study that was halted in 2002, and now it's 2024 and we still have not addressed it. So basically, it's a different time frame. We need to look at more studies with bioidentical, but the studies that have been done are safe with bioidentical. It's exact to the hormones that you're making in your body. The risk and the scare was not needed and not accurate, and we need to now reverse that because we're greater than 20 years out. And we still have women that don't know where to find the treatments and get symptom control for serious and severe symptoms that they're having with perimenopause and menopause. It can be life-changing for them when they have adequate treatment. So that is my take on the WHI. That's why we halted it in 2002. We haven't really addressed it since. The medical community still doesn't understand it. Women are more proactive. They're searching for solutions, desperately searching for solutions, tearful when they find them. And I see that on a daily basis, but we're still scaring them, and that we need to change. We need to close that gap, and we need to educate more physicians so that we can get women the solutions that they need. But there are hormone specialists out there that can offer that. So my suggestion is get your hormones checked, have open conversations with your physician, but it was shut down a long time ago, and we need to change that in medicine. So let me know your comments. Let me know if you saw a physician and you were told that you were not appropriate for hormones, or that perhaps hormones were unsafe, or they cause blood clots, or they cause cancer, because I would love to know your feedback. So just remember, we're willing to deep dive into anything wellness or sexual wellness on this channel. Let me know what you think.